Though acne itself isn't a serious health condition, living with long-term acne can be every bit as devastating as having a chronic disease like diabetes or epilepsy. The shame and embarrassment of regular breakouts can be overwhelming enough to cause depression in some patients. Some patients have even committed suicide. The emotional scars can linger long after pimples have faded. Acne expert Dr. Jackie Doral is here today to discuss new procedures that can help rid of active acne as well as diminish the scars left behind. Thank you for joining us today on Ask the Doctors.
Thank you for having me, Dr. Weibel. It's great to be here.
Great. So first, let's talk about active acne. Tell us about acne and what how prevalent it is in our society.
So we see a ton of acne. It's all over, and I think a lot of patients are confused about what to do. And I think it's our job as a dermatologist to educate our patients about the correct way to wash your face and give patients a correct regimen. There's a lot of bad information out there. There's a lot of things that can actually aggravate your acne. So visiting your local dermatologist is a great idea so that you can get a regimen that's tailored to your skin.
What age should they come see you?
I prefer people come early because it's better to prevent the scarring that occurs with acne early. Afterwards, it's much harder to take care of that scarring. So again, we tailor things to the individual patient with a variety of types of modalities to treat acne.
And tell us about how can acne affect the self-esteem of a teenager or even an adult executive?
Absolutely. So it can be really devastating for a patient, especially in those teenage years when you're feeling very self-conscious and your self-esteem is based on what's on the outside. What we see is our skin, and that's how people perceive you. And even if other people don't notice your acne, sometimes it really reflects back on your soul, and it really can be devastating for some patients. So again, we encourage people to come early before any scarring starts, because there is so much that we can do. Nobody has to walk around with acne scars.
Go ahead.
No.
What do you do for I get it all the time, and in my practice, I'm not sure how to treat them, but people come in with deep ice pick type scarring.
Yeah, and there's two types of acne scars, or you can think about them in two different ways. One is those ice pick scars, those depressed scars that go deep, make a depression in the skin. And then there's also sort of the red or marks that acne can leave afterwards. Those tend to be more temporary and are less permanent, but we do have ways of treating them. So we have specific lasers that treat the red in the skin and that go after those marks. Those depressed scars, there used to be not much that we could do about it. Now we have new fractional lasers that are excellent. And so what they do is they go deep into the skin, into the dermis, and stimulate collagen so that you don't have this rocky contour to the skin. You get a nice smooth contour. And what's nice about those devices is they're low downtime, no pain associated with it. It's really revolutionized the treatment of acne.
And Dr. Doral, one of our viewers is getting married next week, and she wanted to know, is there anything she can do for short-term acne scars?
Absolutely. So obviously we would have loved to have her sooner, but there are some things that you can do in the short term. So for special events like a wedding, I might put her on a little bit of prednisone, just short, so that she could get quick clearing of her acne. And then in addition to that, for any acne scarring, you can put a little bit of filler, dermal filler, and some of our patients may be familiar with these. These are used for cosmetic purposes, so Juvederm or Restylane. It's a hyaluronic acid, which is what's in our skin normally, and you put the filler right in those little acne scars, and they help plump them up so that they're a little bit smoother with the contour of the rest of the face.
And how long does that take? If somebody comes in and says, I want fillers, can they come on their lunch hour, or is this all day?
Oh my gosh, it's so fast. It's very easy, a quick little injection in that spot, very minimal pain. The only downtime would be potentially bruising, but if you're doing it in acne scars, I never see bruising for that.
Right.
I see it more occasionally in cosmetic arenas.
And since we're talking about fillers, anything new in the filler world that we want to share with our audience?
There is. So there's actually a new product on the market. It's called Voluma. It was just recently FDA approved. It's a hyaluronic acid. And what's exciting about Voluma is that it's been FDA cleared for 2 years. Most of our other fillers only last for about 4 to 6 months, sometimes a year. So it's very exciting. And what's great about Voluma is a lot of our patients come in asking about the laugh lines. And what we try to educate our patients is the laugh lines are a symptom of a greater problem, and that's usually the mid-facial volume loss. So as we age, we lose fat and bone structure in our face, and then things hang and we get those laugh lines. So Voluma is an excellent new way to address that mid-facial volume loss.
do you see some of the same problems that I see in the buttock and other areas with people getting illegal stuff injected? Because you made a point about FDA-approved fillers.
Absolutely, yes. And so it's actually, and that's why I brought up that other point. You really need to know what's being injected into your body, so you have to be your own advocate. And there's a lot of things, like permanent fillers are a little bit scary sometimes, especially if you're not getting it done by a board-certified physician, because you can't get those out. And